Hello sir, good day. I am Fermil and I am going to be your nurse for today. So can you state your birth date and your name, sir? Okay, so Mr. Frederick Pasgala. Okay, so sir, based on your medication record, you are scheduled for today's injection. Okay, so you don't have any allergy on some sort of solution, am I right, sir? Okay, so based on your doctor's order, I'm going to administer sterile water. So, do you have any concern regarding with needles or injections? Sir, are you afraid regarding with the needles? Okay, so, sir, it is normal, but don't be scared because I can fully administer the injection without making you feel any pain at all. It's just like a ant bite, okay, sir? Okay, so just sit back and relax. So after verifying yourself to the patient and asking for the patient's name and birth date, you may now proceed to the next step, which is providing the patient's privacy and then making the patient comfortable with its position, and then you may now proceed to the rest of the procedure. Okay, sir, can you move near me? Okay, so after checking for the doctor's order and checking for your materials, preparing for the procedure, you may now wear your gloves. So sir, is this your first time? Okay, so sir, don't be afraid. I'm going to administer sterile water to you, sir. But before that, before proceeding to the procedure, I'm going to explain first what are the things that we need to consider before doing a subcutaneous injection. Of course, we need to consider the 6 rights. We have right patient, right medication, right dose, right time, right route, and of course, right documentation. So after checking for those considerations, we must prepare for the items that we need. Of course, the syringe, the sterile water that we are going to administer, your cotton balls with alcohol. So for subcutaneous injection, we have different sites of injection regarding with that. So we have the back of the hands, and of course the abdomen 2 inch away from the belly button, and the inner thighs. So for the amount that we are allowed to administer through subcutaneous injection, we are allowed to administer 0.5 ml to 2 ml. And then for the gauge that we are allowed to use, we are allowed to use 25 to 27 gauge, and then the inch of the needle we are going to use is about 3.8 to 5.8 inches, and then this is 45 to 90 degree angle. So I have here a tuberculin syringe which has 1 cc and 1 cc or 1 ml, and it has 25 gauge, and the needle is 5.8 inch. Okay, so as you can see, I am checking for the syringe expiration date and the information. Okay, so we have here this, and regarding with the solution that you are going to administer, check for its information and of course its expiration date. Okay, so after that, after explaining these things, you may now proceed to the injection site and administer the solution. Okay, so grab this. So sir, just relax your hand. So based on the medication record of the patient, I am going to withdraw air first, aspirate first before the withdrawal of the solution from the syringe. So it has 1 ml, so I'm going to withdraw 0.9. Okay, I'm going to withdraw 0.9. I'm going to uncap this and withdraw 0.9. then after that, I can put this inside the bottle in order for me to withdraw solution. So after putting this inside, push down the plunger and then withdraw the exact amount that you had aspirated. Okay, so after that, you may check for bubbles on your eye level. Okay, remove those bubbles. Okay, so as you can see, I have zoomed in the video in order for you to see what I am going to do. So grab the clean area that you have wiped with cotton balls and alcohol, and then from 45 to 90-degree angle, you are going to inject the solution. Of course, it is a must that it is a bevel up. Okay, so relax, sir. 45 to 90-degree angle. Insert the solution. And then slowly remove the needle. After the injection, do not recap this, as what I have said earlier, do not recap the used syringe or needle and then dispose it properly on the sharps bin in order for you to prevent contamination and also injuries. Okay, so after that, you are now fully done, and then explain to the patient what are the possible outcomes, and then after that, you may now good to go. Hi everyone! Yes, I am the nurse that you have seen earlier on my recent video, and I had performed the subcutaneous injection to my patient, and my patient was Mr. Frederick Pasgala. So before further ado, I am going to explain on how to withdraw solution from a vial, because earlier I have used sterile water and that is not a vial. Okay, so before explaining it, I had disposed all of the gloves and materials that I have used earlier, and I am wearing a new gloves and I performed hand washing before proceeding to this explanation. Okay, so I have here a vial. It has a needle on it. Okay, so the vial names Anastin. Okay, so I have here a needle. So assume that I am going to withdraw a solution from this vial. So I have a question. When you are going to withdraw a solution from this vial, are you allowed to use the needle that you are going to use to your patient to withdraw a solution from here? Of course not. You are going to need another needle and insert it just like this needle. Any needle would do. And insert it in the vial in order for you to withdraw solution. So in this kind of syringe, you are allowed to remove the needle and then replace it right here. And then after that, after you withdraw solution from this vial, you may now put the original syringe that this, rather the needle that this syringe has. So this needle will be for your patient, and the needle from here will be for the withdrawal of solution. So that is how you are going to withdraw solution. So as what I have said earlier, first withdraw the exact amount that you are going to administer to the patient before getting solution from the vial. Okay, so that's it, and thank you for watching. I hope I had given you a very knowledgeable video. So thank you.